At North Tyneside Art Studio, we use art and creativity to help improve the lives of people experiencing mental health issues in our area. We do this through a range of different hands-on artistic workshops, including painting, drawing, ceramics, stained glass and printmaking. We also try to engage our members in cultural spaces and contemporary and historical art by taking trips to museums and exhibitions, often with an attached creative project. We would highlight an upcoming exhibition of interest, then take a group of members to see this work, as most don't feel comfortable accessing these spaces independently, and then run a series of workshops based on the art or artists involved.
Our priority at Tyne is around creating programmes with long-term, often open-ended trajectories, which focus on deploying collections to improve the health and well-being of our communities. We work alongside professionals from across sectors, particularly health and social care workers, and with our communities to develop and co-create meaningful, useful and relevant work. It is paramount that our work meets the needs of people and places, either in a reactive or reflective way. The main barrier that we identify within our programmes, and the thing that stops people accessing above all else, is relevance. There are numerous well-documented things that create barriers between cultural establishments and the communities that they serve. Things that are really difficult to change quickly. Architecture, location, historical experience, but relevance is an attitude. It doesn't cost anything, you don't have to write a funding bid to get it. You have to listen and act accordingly. Our proprietary work with NTAS really focused in on creating relationships of trust between our two organisations and embarking on a journey together. Sometimes we know where we are going to end up, other times we don't, but the relationships that we build along the way are our strength and actually the best way of overcoming barriers to participation. The pandemic really encouraged us to think about how we deliver our work. As an outreach team, we are of course used to working away from our venues and out in the community. I think during the pandemic we've really escalated the work that we were doing with workers from our partner organisations within health and care and the voluntary and community sector. So much of the last year has really been about sharing with other professionals across sectors and helping them to use culture and creativity within their everyday practice. Whether that be training clinical staff on psychiatric wards how to use sound archives in their patient biography work, or working with nursing staff to design resources for the health and care sector which can be delivered autonomously without museum staff. Our work with NTAS has been a great example of unlocking the collections and really being guided by what the members and workers thought would be most relevant and interesting. It has been wonderful to see NTAS using the collections in various ways that perhaps we might have not thought about doing in the past. The Drawn from the Past sessions are a perfect example of this.
When the pandemic forced us to close our physical studio, our approach was to make as few barriers as possible to access online sessions, and as we already had a good percentage of our members following our Facebook page, we chose to use Facebook Live rather than a closed Zoom format to deliver sessions. For our work with Tyne and Weir archives and museums, screen share and Photoshop allow me to directly interact with the artworks we were discussing, highlighting colour choices, compositional tools and zooming into particular details to give a deeper level of artistic appreciation of the works, alongside discussing the cultural and historic significance of the work. Thanks to these partnership sessions being available to the public, the De Morgan Foundation asked us to deliver a session about their work to coincide with their installed, but at the time inaccessible, exhibition at the Lane Gallery in Newcastle. At the time, we were just reopening the studio on a limited basis, and it seemed like an ideal opportunity to build a project around the work of the De Morgans. Due to the restrictions in place, this began by necessity with the online session, before moving to in-studio workshops using reproductions of the work, and then taking a visit to the physical exhibition at the Lane when restrictions were eased. To my surprise, this trip was perhaps the best cultural experience we had delivered through NTAS. Participants were significantly more engaged with the work and more comfortable in the space than any other museum or gallery visit I can remember. Seeing the full physicality and scale of some of the works led to a deepening appreciation and personal connection for some members, and many members quizzed the curator on details about the artist's life and approaches in a way that I had not previously seen. The radically different approach that we took to the De Morgan project resulted in better outcomes for our members. They engaged more with the subject matter, found deeper connections and had greater comfort and sense of belonging in the gallery space as a result, and we will be making this approach with other collaborations in the future. This approach was driven by necessity, but for me it highlighted a very real issue for artists and curators who wish to engage people who are barriered from regular engagement with art. We must step back from the reverence which we bestow upon the artwork and the expectation that exposure will generate inspiration and engagement. Taking reproductions of work into spaces in which our members are comfortable and using artistic methods to explore and reinterpret the work builds a stronger appreciation and understanding of the artwork and the artist, as well as opening up conversations about the historical and social context of the work in a way that feels relevant to participants. By undertaking this work before exposure to the real objects, participants feel more connected to the work, and this grounds them in having a right to be in the gallery space as active participants in exploring the art rather than passive viewers being allowed entry.